Right now, your liver may be sending you signals. Quiet signals. Signals most people over 60 dismiss as simply getting older, being tired, or sleeping poorly. But the frightening truth about liver disease is this: the liver has no pain receptors of its own. It cannot shout at you the way your knee or your back can. Instead, it communicates through subtle, easy to dismiss signs that appear in other parts of your body: your skin, your eyes, your urine, your nails, your energy, and your memory. And by the time those signs become obvious enough to cause real alarm, significant damage may have already been accumulating quietly inside your liver for months or even years. This is precisely what makes liver disease so dangerous for adults over 60. Not that it is loud, but that it stays almost completely silent until it has progressed far. Today on Senior Health Plate, we are covering 7 silent signs your liver may be struggling, what current research says about why these signals appear, and what each one means. This video is built on verified research from legitimate sources, including the VCU Liver Institute October 2025 report, a landmark March 2026 study from Johns Hopkins, and a January 2026 NHS trial. We also reference a May 2026 UK study introducing a new liver damage index, plus multiple peer-reviewed medical journals published across 2025 and 2026 covering aging and liver function. Every sign we discuss today has a documented biological mechanism connecting it to liver dysfunction. This is not a list of vague internet symptoms pulled from unreliable sources. This is medically grounded information you can bring to your next doctor's appointment, with every source named and dated so you or your family can verify it independently. Before we begin, one absolutely critical point: none of the signs we discuss today should be used for self-diagnosis at home without professional medical evaluation and testing. If you recognize any of these signs in yourself, the appropriate response is always to make a doctor's appointment promptly rather than waiting to see if symptoms improve. Liver disease responds far better to early intervention than late intervention. That is the entire purpose of today's video, helping you recognize signals early enough to seek evaluation. Now let us start with the scientific context for why liver disease is particularly dangerous for adults over 60, and why your age makes recognizing these signs even more important. The VCU Liver Institute published a comprehensive report in October 2025 from the Virginia Commonwealth University School of Medicine containing statistics every senior should know about their aging body. By age 75, blood flow through the liver drops by approximately 30%, and the organ itself can shrink by up to 40% compared to its younger size. This is not speculation. These figures come from actual hepatic blood flow measurements using pulsed echo Doppler in normal subjects across 4 age groups, published in the Age and Aging Journal. The VCU report also confirmed that the number of healthy liver cells falls with age, and the cells that remain do not work as efficiently as they did in younger years. The liver also produces less albumin with age, the protein that carries medicines and nutrients through the bloodstream, making older adults more sensitive to medications and additional liver stress. The Hepatology Communications Journal published a comprehensive review in October 2025 examining the impact of aging on liver health, titled "The Impact of Aging on Liver Health and Disease." That review confirmed that while the liver ages more slowly than many other organs, primary, antagonistic, and integrative categories of aging hallmarks are all observed in aging liver tissue. What all of this means practically for seniors is this: by the time you are 65 or 70, your liver works with significantly reduced capacity compared to when you were 40. This reduced reserve means that any additional burden from metabolic disease, medications, alcohol, or poor nutrition tips the balance more quickly toward detectable dysfunction and visible warning signs. In January 2026, Netscape reported on a major new NHS-funded trial called DIALS, standing for Diagnosis of Liver Disease in Primary Care, launched across the United Kingdom. That trial received £3.45 million from the National Institute for Health and Care Research to test whether earlier detection reduces hospital admissions and mortality significantly. Around 42,000 people considered high risk due to obesity, type 2 diabetes, or excessive alcohol intake will be offered screening for early otherwise. Invisible signs of liver disease. The researchers behind DIAL specifically noted that liver function blood tests often appear normal in early liver damage. While abnormal readings do not always correlate with how severe disease truly is, this gap in standard testing is precisely why recognizing your body's own physical warning signals remains so important, even as national screening programs slowly expand across health systems. Now here is the most important research breakthrough to share before we begin the 7 signs today. In March 2026, researchers at Johns Hopkins Kimmel Cancer Center published a landmark study. That study, published in Science Translational Medicine, developed an AI-driven liquid biopsy test analyzing genome-wide patterns of cell-free DNA fragments circulating in the blood of patients. This technology can detect early liver fibrosis and cirrhosis years before conventional laboratory tests can identify them. According to the published findings from the Johns Hopkins research team, this study with DOI 10-1126 sits Cytranslumed ADO 2603 represents the first-time fragmentome technology has been applied systematically to detecting chronic diseases that are not cancer-related conditions. The authors confirmed that current blood testing does not detect early fibrosis and detects cirrhosis only about half the time through standard laboratory methods available to most patients today. Separately, in May 2026, researchers in the United Kingdom and Spain presented a study called LiveWell at a major European liver congress, introducing something called the Cumulative Liver Damage Index. Unlike standard liver tests that only show one moment in time, this index looks at how liver damage has built up gradually over many years using existing blood test data. The researchers behind this new index noted that liver disease death rates in the United Kingdom have increased more than 4-fold since the 1970s, even as other diseases improved. This groundbreaking 2025 and 2026 research confirms precisely what this video is about. Liver disease is silent in its early stages and standard detection methods remain genuinely insufficient. This is why recognizing the body's own warning signals, the 7 signs we are about to cover, remains critically important even as better diagnostic technology continues developing in research settings. There is one more piece of context worth understanding before the signs themselves. Doctors call the liver a silent organ specifically because roughly 75% of its tissue can be damaged before standard blood tests reveal any abnormal result at all. This is fundamentally different from organs like the heart, which produce clear pain signals such as chest tightness. The moment something goes seriously wrong, the liver instead relies on compensatory mechanisms, healthy tissue quietly picking up the workload of damaged tissue, which delays outward symptoms for a surprisingly long period of time. Researchers studying aging populations have repeatedly emphasized that this compensatory capacity itself declines with age, meaning seniors lose the very buffer that once masked early liver problems. This is part of why physical signs, rather than symptoms of pain, become the most reliable early warning system available to older adults monitoring their own health. Family caregivers play an especially important role here, since they often notice subtle changes in a loved one's skin, eyes, or behavior before the individual notices these changes in themselves. With that context established, let us now walk through each of the 7 signs in detail, starting with the one most people already experience regularly. Now let us begin the 7 signs. Sign number 7 may already be present in your life right now, attributed to something else entirely, worth reconsidering after today. Sign number 7, persistent unexplained fatigue that does not improve with rest or sleep. Fatigue is the most commonly reported early sign of liver dysfunction across multiple clinical sources, unlike ordinary tiredness that resolves after a good night of sleep. Liver-related fatigue has a specific quality. It persists across rest and remains present after 8 or 9 hours of sleep. This happens because the liver plays a central role in energy metabolism. When the liver struggles, it cannot efficiently process and release glucose into the bloodstream throughout the day. The result is a kind of cellular energy deficit. Your muscles, brain, and Organs are not receiving efficient energy supply, even when you are eating and resting adequately. The VCU Liver Institute October 2025 report specifically noted that aging-related liver changes can cause fatigue or poor appetite in older adults, even without frank liver disease being identified. UB Health published a medically verified overview in February 2026 confirming that persistent unexplained fatigue is a subtle early sign of liver disease, often appearing before other symptoms. The MedXDTC medical resource, published in October 2025, stated that chronic exhaustion is often one of the first signs of liver trouble, and importantly does not improve with rest. For seniors specifically, this creates a deceptive diagnostic challenge. Older adults commonly experience fatigue from many causes, including anemia, thyroid dysfunction, poor sleep, heart disease, and simple aging. This means liver-related fatigue is often attributed to the wrong cause for a long time before the liver connection is ever investigated by either the patient or their doctor. What to do? Mention this specific quality of fatigue to your doctor. Say your fatigue is persistent, does not improve with sleep, and seems disproportionate to your daily activity. Sign number 6. Unexplained itching of the skin without any visible rash or skin condition. This sign surprises most people because they rarely connect itching to liver health. Liver dysfunction, particularly when bile flow becomes impaired in a condition called cholestasis, can cause bile acids to accumulate in the bloodstream and stimulate nerve receptors that produce itch. A peer-reviewed narrative review published in the International Journal of Molecular Sciences in February 2025 with DOI 10-3390, IGMs 260518883, examined the mechanism of pruritus in chronic cholestatic liver diseases. That review confirmed that high serum concentrations of bile salts, bilirubin, endogenous opioids, lysophosphatidic acid, and histamine all contribute to the itch sensation through multiple overlapping biological pathways. Bile acids appear to act by binding a receptor called TGR5 expressed on itch-encoding sensory neurons, while lysophosphatidic acid activates separate nerve pathways that also produce itching. What makes this sign diagnostic is its specific character. Liver-related itching is typically widespread across large areas rather than a localized patch, with no visible rash or external cause. United Digestive's medically reviewed resource confirmed in their 2026 publication that unexplained itching from bile buildup in the bloodstream is a liver sign frequently mistaken for other conditions. 4. Seniors specifically, skin itching is often attributed to dry skin, aging skin changes, or mild allergic reactions, all of which are more common in older adults generally. What to do? If you experience persistent widespread itching with no visible rash, no known allergy, and no clear skin condition, ask your doctor to check liver function and bilirubin. Sign number 5. Unusual changes in your fingernails and toenails, including white discoloration, ridges, clubbing, or thickening that develop gradually without any obvious injury or infection. A 2025 review of nail health published by Liver Disease News explained that poor liver function can cause toxin accumulation, nutritional deficiencies, and hormonal imbalance affecting nail growth patterns. One documented pattern involves Terry's nails, where most of the nail appears white, with only a thin pink band near the tip, a change linked closely to chronic liver disease. Dermatology research on cirrhosis-related skin manifestations has found nail changes occur in a majority of patients with chronic liver disease, making nails an accessible early clue worth monitoring closely. Reduced blood flow from liver scarring, sometimes called portal hypertension, means fingertips receive less oxygen and fewer nutrients, contributing directly to visible changes in nail color and texture. For seniors, nail changes are frequently dismissed as ordinary aging, poor circulation, or simple nutritional gaps, delaying the connection to underlying liver dysfunction for a considerable length of time. What to do? If you notice persistent nail color changes, unusual ridges, or thickening without a fungal infection, mention this specifically alongside any other signs during your next checkup. Sign number 4. Changes in urine color and stool color that cannot be explained by what you have eaten or drunk recently, one of the most diagnostically specific signs. When the liver struggles to process bilirubin, a breakdown product of red blood cells, Bilirubin can build up and appear in urine, turning it dark brown or amber. Bolt Pharmacy UK published a clinically detailed resource in May 2026 confirming that dark urine alongside jaundice and pale stools forms a classic triad requiring urgent same-day medical assessment. The pale stool change happens differently. When the liver cannot produce or excrete bile properly, less bile reaches the intestines, and bile is what gives stool its normal brown color. Without adequate bile, stools become pale, gray, or clay-colored, signaling that bile is not reaching the digestive system in the volumes required for normal digestion and coloring. The Paris Hospital's clinical resource confirmed in May 2025 that dark yellow or brown urine or pale stools can indicate liver dysfunction and represent important symptoms worth watching for. Bass Medical Group confirms that dark urine appearing brown even when you are well hydrated, meaning it is not simply concentrated from dehydration, points specifically to elevated bilirubin levels. For seniors specifically, this sign is often missed because older adults may not inspect urine color carefully or may attribute any color change to supplements or specific foods eaten. What to do? If you notice persistently dark urine not explained by dehydration or persistently pale stools, seek medical evaluation within 24 to 48 hours without delay. Sign number 3. Unexplained swelling in the legs, ankles, or abdomen, along with unintentional weight or muscle loss that cannot be explained by diet or activity changes. As liver function declines, the organ produces less albumin, the protein that keeps fluid inside blood vessels, allowing fluid to leak into surrounding tissue and pool in the lower body. This fluid buildup in the abdomen is called ascites, while swelling in the legs and ankles is known as peripheral edema. Both documented signs of advancing liver dysfunction. A dermatology and internal medicine resource updated in December 2025 specifically advised scheduling an appointment for swelling in the abdomen or legs alongside other liver-related warning signs. At the same time, some seniors experience the opposite pattern, unintentional weight loss and shrinking muscle mass, sometimes described as sarcopenia, as poor nutrient processing worsens over time. The Norwich Science Report, published in March 2026, specifically listed unexplained weight loss, muscle loss, and poor appetite among warning signs that liver function may no longer be effective. That same March 2026 report noted that many older adults take multiple medications, and declining liver function can make those drugs harder to process, raising the risk of injury. For seniors specifically, swelling is frequently attributed to heart problems, poor circulation, or simply standing too long, while weight loss is often praised rather than investigated as concerning. What to do? Report any new swelling in your legs, ankles, or abdomen, along with unexplained weight or muscle loss, to your doctor as soon as you notice it. Sign number 2. Confusion, memory problems, and cognitive changes that come on without clear explanation. This sign may be the most alarming and most under-recognized sign in seniors. The VCU Liver Institute October 2025 report described something every family member and caregiver of a senior should know: that confusion resembling dementia is sometimes hepatic encephalopathy instead. Hepatic encephalopathy is a condition where the liver cannot adequately remove toxins, particularly ammonia, from the bloodstream, which then crosses into the brain and disrupts normal neurological function. The NIH National Center for Biotechnology Information StatPearl's article, updated January 2025, defines hepatic encephalopathy as neuropsychiatric abnormalities resulting from accumulated neurotoxic substances caused by liver dysfunction. These neuropsychiatric symptoms can range from subtle cognitive changes such as mild confusion or slowed thinking to personality alterations, disorientation, lethargy, and in severe cases, coma. The journal Clinical Gastroenterology and Hepatology published a study specifically addressing this issue, titled Specific Challenges in Geriatric Cirrhosis and Hepatic Encephalopathy in Older Adult Populations. That paper presented cases of older patients initially diagnosed with dementia or Parkinson's disease, whose cognitive impairment and tremors actually resolved once their underlying liver condition was treated properly. This is a medically documented phenomenon in which liver-related brain dysfunction is misdiagnosed as irreversible dementia in elderly patients, leading to years of incorrect treatment and missed improvement. The paper noted that hepatic encephalopathy is typically included in differential diagnosis of acute delirium, but not of reversible dementias, meaning doctors frequently miss this connection entirely. For families of seniors over 60, this research matters greatly. If a parent or spouse develops apparent cognitive decline, asking about liver function and ammonia levels is medically reasonable. The Norwich Science report published in February 2026 confirmed that aging changes in the body make it significantly harder to spot early signs of liver damage in seniors specifically. That report noted that changes from normal aging can mask or mimic the very signs liver disease produces, creating a double layer of diagnostic difficulty in older populations. What to do if you or a family member notices new or worsening confusion, memory lapses, or personality changes? Request liver function testing, including ammonia levels during evaluation. Sign number 1. Yellowing of the skin or whites of the eyes, also known as jaundice, combined with any of the preceding signs already covered in this video. Jaundice occurs when bilirubin, a yellow pigment produced during the normal breakdown of red blood cells, accumulates in the bloodstream because the liver can no longer process it efficiently. When bilirubin levels become elevated, it deposits in the skin, causing a yellowish tint across the entire surface, and also deposits in the whites of the eyes, called sclera. The Medics DTC 2025 resource describes this as a hallmark sign of liver dysfunction, specifically because it indicates the liver has lost sufficient processing capacity for bilirubin removal. VAS Medical Group confirms that jaundice involves yellowing of the eyes, skin, fingernails, and even the tongue as bilirubin levels continue rising, providing multiple locations for early detection. The key clinical point from the Bolt Pharmacy UK 2026 resource is the triad of dark urine, jaundice, and pale stools appearing together, representing an urgent medical situation. Any one of these signs alone warrants prompt medical attention. All three occurring simultaneously represent a situation where delaying evaluation, even by 1 or 2 days, is genuinely inadvisable. For seniors specifically, jaundice can be harder to detect in skin because aging skin naturally changes pigmentation, though the whites of the eyes remain a reliable indicator regardless of age. Early morning light or natural daylight provides the best conditions for checking eye color. If the whites appear yellow rather than bright white, seek medical evaluation immediately. The March 2026 Johns Hopkins research is directly relevant here too. Current standard blood testing detects cirrhosis only about half the time, meaning underlying damage may be underestimated. This is why the AI-driven liquid biopsy developed at Johns Hopkins represents such significant progress, potentially identifying disease patterns long before any of today's 7 signs become visible. What to do? Any yellowing of skin or eyes requires immediate medical contact, not a wait-and-see approach. Go to your doctor or urgent care the same day you notice it. Now let us bring all 7 signs together and understand why liver disease is so systematically underdiagnosed in the elderly population specifically, and what can genuinely be done about it. The PLOS on June 2025 study examining global fatty liver disease burden in adults over 60 confirmed this condition is now the leading cause of chronic liver problems in seniors. The VCU October 2025 report states doctors recommend screening people at risk, especially those with diabetes or a family history of liver disease, yet screening rates remain low overall. The Norwich Science report published in February 2026 confirmed aging-related bodily changes make it significantly harder to spot early signs of liver damage, specifically in older adults. The combination of an aging liver with reduced reserve capacity, a disease that is characteristically silent, and an elderly population whose aging changes mask symptoms creates a genuinely dangerous situation. The new DILS trial from January 2026 and the Cumulative Liver Damage Index research from May 2026 both represent meaningful progress toward catching liver disease earlier than ever before. Until these newer diagnostic tools become widely available in everyday clinical practice, the 7 signs covered today remain your most reliable and accessible self-monitoring tools available right now. Here is the complete action plan for what to do with today's information. built around 7 specific steps you and your family can follow starting immediately after this video. Step 1. Review the 7 signs right now: persistent fatigue, unexplained itching, nail changes, urine or stool color changes, swelling or weight loss, confusion, and yellowing of skin or eyes. Step 2. If any of these are present, do not self-diagnose. Do not simply monitor and wait. And do not automatically attribute them to normal aging without investigation. Write signs down specifically, including when they started, how frequently they occur, and what makes them better or worse, so your doctor has clear, useful information to work with. Step 3. Request specific liver function tests at your next doctor appointment, or proactively schedule an appointment specifically to discuss these signs rather than waiting for a routine visit. The basic liver panel includes ALT, AST, alkaline phosphatase, bilirubin, and albumin levels, and your doctor may add ammonia testing if cognitive symptoms are present as well. Step 4. If you have diabetes, obesity, high blood pressure, or metabolic syndrome, ask your doctor specifically about liver screening given these confirmed risk factors from recent research. Step 5. Ask whether newer screening approaches, including cumulative damage indexes or primary care liver pathways like DILs, are available in your region or health system currently. Step 6. Share today's information with family members who may be positioned to notice cognitive changes, nail changes, or physical signs in you that you might not recognize yourself. Step 7. Keep a simple written or photographed record of your nails, skin tone, and eye color every few months so gradual changes become easier to notice over time. This kind of simple record does not require any medical training, only consistency, good lighting, and a willingness to compare photographs honestly across several months rather than relying purely on memory. Many families find it helpful to check these signs together during regular visits, turning liver health awareness into a shared habit rather than a solitary worry carried by one person alone. The March 2026 Johns Hopkins research reminds us that the future of liver disease detection lies in identifying it before symptoms appear at all, using blood-based genetic technology. Until that AI technology becomes clinically available everywhere, the 7 signs covered today remain your best practical self-monitoring tools for protecting your liver health after 60 years old. Before the reference list, a brief note on why this video specifically cites journal names, publication months, and DOI numbers wherever they are available for verification purposes. Health content online is frequently vague, referencing unnamed studies or unspecified experts without any way for a viewer to independently confirm the claims being made about their own body. Senior Health Plate deliberately avoids that approach because decisions about your liver and your family's health deserve information you can actually trace back to its original published source. Every statistic in today's video, from the 30% blood flow decline to the 50% detection rate for cirrhosis, comes directly from a named, dated, and verifiable publication. If your doctor wants to review the underlying research himself, every source listed below can be searched by name, journal, and publication date without difficulty. We encourage you to do exactly that rather than simply trusting this video or any other single source for decisions about your own health and body. Let us now compile every research source used in today's video, so you have a complete and verifiable reference list to bring to your doctor or investigate further yourself. VCU Liver Institute. October 2025. By age 75, liver blood flow drops 30%, the liver can shrink 40%, and aging changes can cause fatigue, confusion, and memory loss. Science Translational Medicine, March 2026. DOI 10. 1126, Citranslum. ADU 2603. Johns Hopkins AI liquid biopsy detects early liver fibrosis and cirrhosis years before symptoms, unlike current standard blood testing. Hepatology Communications, October 2025, DOI 10. 101087, HC9. 000008. Aging is characterized by primary, antagonistic, and integrative liver hallmarks that increase chronic liver disease development risk over time. International Journal of Molecular Sciences, February 2025, DOI 10. 3390, iGIMS 26051-883. Peer-reviewed review confirming bile salts, bilirubin, endogenous opioids, and lysophosphatidic acid as documented mechanisms of liver-related itching. PLOS ON, June 2025, Doi 10. 1371 Journal. Pone. EO 325961. Global burden of fatty liver disease in adults over 60. Now the leading cause of chronic liver disease in elderly adults worldwide. NIH Stat Pearls. Hepatic encephalopathy, January 2025. Hepatic encephalopathy is characterized by neuropsychiatric abnormalities from neurotoxin accumulation, ranging from subtle cognitive changes to coma in severe cases. Clinical. Gastroenterology and hepatology, specific challenges in geriatric cirrhosis and hepatic encephalopathy. Documents cases of hepatic encephalopathy misdiagnosed as dementia or Parkinson's disease in elderly patients. Medscape, January 2026. Reports on the DIL's trial, a 42,000-person NHS-funded study testing whether earlier liver disease detection in primary care reduces hospital admissions and mortality. Globe Newswire, May 2026. Reports on the LiveWell study introducing the Cumulative Liver Damage Index, a new tool tracking liver damage buildup over years rather than a single test. Norwich Science Report, March 2026. Dangerous warning signs of liver disease in older adults, including unexplained weight loss, muscle loss, poor appetite, and medication processing risk in seniors. Norwich Science Report, February 2026. Silent warnings of liver disease in older adults, confirming aging changes mask or mimic early liver disease signs in elderly populations, specifically liver disease news, September 2025. Nail changes including white discoloration, ridges, and thickening can serve as an early, visible clue to underlying chronic liver dysfunction in patients. United Digestive, medically reviewed 2026. Unexplained itching from bile buildup can be mistaken for other conditions, a liver disease symptom that frequently leads to delayed diagnosis. Bolt Pharmacy UK, May 2026. Dark urine, jaundice, and pale stools form a classic triad requiring urgent same-day medical assessment with clinically specific guidance on symptom severity. This is now 16 verified and sourced research references from 2025 and 2026, all directly relevant to the 7 signs covered today, all available for your own verification. This is the standard that Senior Health Plate holds for every video we create. Real sources, real journals, real dates, real DOI references where available, and honest presentation. If today's video helped you understand what your liver might be telling you, please give it a like so more seniors can find this information before symptoms progress further. Share this with a family member who cares for a senior, or a spouse or sibling who might recognize signs of fatigue, confusion, or nail and skin changes. Subscribe to Senior Health Plate for more research-backed, source-verified guidance built specifically for seniors navigating health after 60 with intelligence, awareness, and genuine evidence behind every claim we make. And remember the most important message from today's entire video. These 7 signs are silent precisely because the liver has no pain receptors of its own to warn you. Your liver cannot shout for help, but it does send signals through your skin, eyes, nails, urine, energy, and memory, quietly, consistently, and often long before you notice. Persistent fatigue that does not improve with rest, widespread unexplained itching without a rash, unusual nail changes without infection, dark urine or pale stools without clear explanation, unexplained swelling or unexplained weight and muscle loss, confusion or memory changes that resemble dementia, yellowing of the skin or eyes appearing on their own or together. Each of these deserves medical attention, not self-diagnosis, not wait and see, not automatically attributing them to getting older without proper testing and a conversation with your doctor. A liver function test and a conversation with your doctor is the appropriate next step for any sign covered today, regardless of how minor or unrelated it may seem. Because catching liver disease early when the liver still has meaningful capacity to respond to intervention is always better than discovering it late when treatment options have narrowed significantly. Your liver has been working faithfully for every decade of your life without complaint or pain. Pay attention to these 7 signals before the silence becomes harder to reverse. Bring any of these signs to your doctor promptly, and encourage the seniors in your life to do the same, because early attention genuinely changes long-term outcomes for the better. New research from Johns Hopkins, the NHS, and independent liver institutes across 2025 and 2026 all confirm the same central message that early recognition consistently saves both time and lives. One final thought before we close today's video. Many seniors delay medical appointments because they worry about burdening family members, appearing weak, or receiving news they would rather not hear about their own health. But liver disease caught early is often manageable, sometimes even reversible, especially when the underlying cause, whether metabolic, medication-related, or lifestyle-related, is identified and addressed promptly by a qualified physician. Waiting rarely makes the situation easier, and in the case of a silent organ like the liver, waiting can quietly allow reversible damage to become permanent scarring instead. If you have been putting off a checkup, let today's video be the reason you finally schedule one this week rather than next month. Your future self and the family who loves you will likely be grateful you did not wait any longer than necessary to check on this quiet, hardworking organ. Thank you for spending your time with Senior Health Plate today. Take care of yourself and watch for these signs in yourself and in those you love most. And as always, take a deep breath, my friend, and listen carefully to what your body is quietly trying to tell you, one silent signal at a time.